to our very special conversation with our special guest, Janice Phillips. The format for the lunch is that I'm going to interview Dr. Phillips. We're going to broadcast this on our YouTube channel through the Institute for Leadership and Service. While you will get to eat, we get to talk and get a sort of snapshot of her background and insights, and then I'll ask you to introduce yourselves and share some of your questions with her. So please go forth and eat while we go forth and meet.
Okay.
And talk a little. So welcome,
Thank you so
Janice Phillips, to Valparaiso University and Pathways to Purpose, a special visitor series of the Institute for Leadership and Service. We're so excited to have you here today.
Thank you.
Just a word about Janice Phillips. She has, as she puts it, many alphabets after her name, a PhD, an MS, an RN, an FAAN, and she serves as Director of Government and Regulatory Affairs for the Commission on Graduates of Foreign Nursing Schools International, Inc. She has also held so many interesting roles as a nurse researcher, academician, international scholar, clinician, and consultant. So I just want to find out a little bit about your journey through some of those roles. Let's start at the beginning of that journey, and what led you into nursing in the first place?
Well, I actually wanted to be a teacher. When I finished high school back in the 70s, she was like, everybody in your class is going to be a teacher, so Mom, think about something else because you want to have a job. I didn't know that was incorrect, but anyway, I just said, okay. So I said, well, I want to do something to help people. I definitely want to help people. And I didn't know a lot of nurses. I knew that there was a school nurse and there was a nurse at Cook County. So I didn't really know a lot of nurses, but I knew I wanted to help people. And so at that time I was in foster care, and my social worker, it was my social worker, Anna Marie Earls, who introduced me to North Park College. And we went there and we had a tour. And since the state was paying for me to go to school, I selected North Park College to go to nursing school. I still got my wish in the end about being a teacher, because as you know, nurses teach. Not only do they teach patients and communities, they also teach students. So I still got my wish in the end, the nurse, the helper, and the teacher.
And you, in getting into nursing, you decided to focus on community health and public health nursing. Was that something that happened while you were at North Park? Did that develop later?
Actually, I think the foundation started there at North Park. And the reason why I say that is because we had to do a research project. And back in the day, it was very unusual to have a four-year baccalaureate program have a required full-blown research project for you to graduate. Now, you think about research starting at the master's level. At the baccalaureate level, we had to have a full-blown research project. And my research project was at a community-based center, looking at health beliefs among African Americans. And I collected my data and analyzed my data with a lot of help, and began to really try to understand this whole issue of minority health and health disparities before we were even calling it health disparities. I actually was looking at health disparities and we didn't have that coined phrase, minority health, back when I was in school. And I actually loved it. And I think my foundation actually started at the baccalaureate level. And subsequent to that, my first job was at Major Medical Center, University of Chicago. But it wasn't until I went to the emergency room that my whole career just kind of came to life. Because I got to care for people from every single walk of life, from homeless to dignitaries. I was able to take care of those patients and made that connection between community health and public health and the acute care setting. Because the same people that were coming into the ER are the same people that you find in the community looking for health care services. Same people coming into the doors of the ER, the same people that need health education, that need to be engaged in health promotion, that need to be linked to resources in the community. And that's what, actually, I love that. And even though the ER is a place where we can use a lot of different skills, and saw a lot of different trauma patients. But even when you look at a trauma patient, there's a preventive aspect to that too. Whether it's a gunshot wound or whether it's gun violence or whatever, there's a preventive piece to that as well. So I was probably the only nurse running around trying to make the connection between emergency nursing and public health. So much to the point that I told the students earlier today, we had a lot of women that we would do a lot of gynae exams for. And I said one day, these women think they're getting a pap smear in the ER because they're not getting a pap smear. And so I started this education campaign in the ER, educating all these women about what they were really getting in the ER when they came for a gynae exam. And the gynae exams were for other things, of course. But I thought, what a wonderful way and a wonderful teachable moment to talk about cervical cancer prevention. So I went around, and in all of the little cubicles where we did gynae exams, had these posters up on the wall about cervical cancer prevention. And then I had a little checklist when they got discharged. They had to sign on the form saying, I did not have a pap smear today, but I did have these types of exams in the ER. And encouraging them to think about cervical cancer prevention.
That ability to see in the immediate work you're doing these undeveloped connections, and then to build on those, to name them, build a practice around them, that's quite an extraordinary gift. I mean, you're saying, for instance, that the connection between emergency room nursing and community health, that probably wasn't a fully described or investigated connection. So there you are doing it, you begin to see it happening, and you begin to innovate on that. Where does that come from? How did you learn to be that way in the world?
I don't really know. I just know that there's this part of me that wants to help people. And I just loved being a nurse, but I didn't like, I liked all the bells and whistles, but it just seemed like there was so much more to it than just putting an IV in and give somebody discharge instructions about how to wound care. I mean, there was so much more. In the ER, it was so many different kinds of people and so many needs. It was just like, okay, this is a playground, if you will. And I can do this and I can do this, but I have the audience and I have the venue to do more than just all these skills that you have to do. Put the IV in, take the vital signs. There was so much more. It was a rich environment to just sort of like express yourself and to give people what you would like to receive if you were coming into this setting with limited education. You didn't know about a particular resource. So I don't know if that was an innate thing or what, but it probably is what brought at least probably more satisfaction than just going into the trauma room and watching somebody get their chest cracked. You know?
But it's interesting, you talk about it coming out of a desire to help others. I think there's a lot of conversation these days about social innovation and social entrepreneurship, and young people are encouraged to sort of find that new thing that they can do differently, that they can innovate on. It sounds like you, as a young person, came into it really driven by a desire to help, and that led you to the new things. Yeah, so I'd like to talk a little bit about that desire to help. You have, in the past, used the phrase, learn, earn, return. And it's such an interesting call to generosity and giving in a profession that's already oriented towards giving. How do you think about that? How do you think about the role of giving in nursing and in your own mind?
Well, let me just say a little disclaimer here. I didn't really coin the term learn, earn, and return. I read that somewhere, and I thought it sounded pretty good to me. I'm going to build a whole presentation around learn, earn, and return. Because if you think about how we have gone about our careers, it's the same path for everybody. We learn. We're students at some point, whether we're in college or whether we're in high school or whether we're just in grammar school or whatever, we're learning. At some point, we hope to move out into the world and earn a living. And we hope to earn the respect of the people that we serve and the people that know us. And then there's that return piece. I firmly believe, and it's It's so in sync with the scripture, to whom much is given, much is required. When you've been given something and you've been equipped with educational resources, it wouldn't do any good to keep it to yourself. It really is about returning to the universe. And we can return in so many ways. You can return financially. You can return by just mentoring somebody. You can return by supporting someone. And it's not always linear. We're always learning. We may always be earning something. And then we can start returning, not at the end of our career, but at the very beginning. We've got something to give back, even before we become professionals or before we become college educated. So that learn, earn, and return, it came from some genius out there, and I thought, well, that's really the story of that's the framework for my life.
Well, thank you for coming here and sharing a little bit about the framework of your life with us. Here at Valparaiso University, we believe in learn, earn, return, and eat.
Yes.
Well, we're going to take a break now and eat lunch and welcome the conversation from other participants. Thank you so much.